Good afternoon. The good news is that this is the last talk for today, and the extra good news is that it's going to be shorter than the 12 minutes that was allocated. I feel a little bit like Tony Robbins with one of these headpieces on. I've never spoken with this microphone before. So I'm from Melbourne, Australia, as was introduced, and I'd like to acknowledge the two doctors, or one doctor and one scientist who helped with this, Dr. Larissa Miller and Christopher Apostolou. We did a study in January that looked at the question of fractional erbium laser, or the SP Dynamis, and PRP to see whether PRP will augment the results. So I'll just quickly run through the types of patients that we were looking at have striae. So this is a common problem that I'm sure many of you see wherever you are in the world, and it's a problem that obviously affects a lot of women, mostly women, post-children or with significant weight gain. There was one man in our study. We had 18 patients with striae, and we set the same parameters with the laser for all the patients because we wanted to test whether PRP would make a difference. And we're only doing one treatment with the laser. But we did 3 different treatments with the PRP, and I'll explain that in a moment, because we wanted to see what type of PRP, in terms of how it was administered, whether that would make a difference to the result. We used SP Dynamis Pro with an L runner with those settings, and then an F runner, trying to create some pause and some stimulation of the tissue remodeling in the scarred areas. There are a lot of different PRP kits available, but I used a dual spin method that's been written up before. I can give you the parameters, but it was interesting to see how our system compared to a regen system that I had lying around, and we tested a couple of patients, and I'll explain what we found. But for our 18 patients, we found that the average platelet count, because we took some blood and we measured what their baseline platelet concentration was, and then we created the PRP and we tested the concentration increase to see how much we actually concentrated the platelets. So the average was about 268,000, which is pretty much within the normal range. The first group that we used PRP for, it was a dual spin with these parameters. All of the patients just had topical local anaesthetic. There was nothing else. There was no local use. There was no sedation or anything like that, because we wanted this to be real world and to simulate what we would do in our practices. And using topical anaesthetic is much handier than doing anything more invasive. So we had a topical anaesthetic and we randomized the side. So we told the patients that we'll do a treatment of laser for you, and then we'll do a treatment of PRP, one side but not the other. And we wanted the patients to gauge the level of improvement that they experienced. The second group, just to go back, this was the concentration of platelets that we got, which is quite low compared to what the commercial kits claim. The second group, because these were separated, these groups of 6 were separated by a few weeks, about 3 or 4 weeks, we had a chance to see the effects of the double spin that we were using, and to improve it, I changed the technique in terms of trying to increase the concentration of platelets that we were generating from the PRP. So that's why it went up from 1.5 times baseline to 1.7 times with a slightly different protocol. This time, rather than injecting or putting the PRP topically, we used a 25 gauge cannula and injected subcutaneously. And again, the sides were randomized. So the patients had it treated on one side, but not on the other. The final group of 6 patients, we managed to get the PRP up to 1.8, but it's still less than what it might ideally be, and I'm inviting you to tell me in the next day or so, if you see me, tell me what you use for PRP and what your protocols are, because I think that this is too low. The final group, we used intradermal injection with a 30 gauge needle in a meso type injection of PRP. So the first group had topical, the second group had cannula, subcutaneous, or subdermal really, and the final group had intradermal using a 30 gauge needle in a meso technique. Again, the sides were randomised. So what were our results? 14 of the patients returned for photos, and these were all done at the 3-month stage, some up to 3.5 months. Of those patients, of the 14 who returned, 6 self-reported improvement with 1 treatment. And there was no difference, we found no difference with the PRP in the way that we made it in this scenario with these protocols. So I'm not sure if this comes out very well for you, but one of the problems we encountered was mild PIH in patients. And this was not really correlated with their skin type, Fitzpatrick skin type. So PIH was an issue. The patients didn't really complain about it, but it's probably best to do this sort of in winter. And there's a mild improvement in the skin texture. If you have a look at these lines here around just below the umbilicus, the skin is a little less wrinkly, and around the scar here, the skin is a little bit firmer, but there's still PIH. This is just 1 treatment. You'd probably need 3 or 4, I guess. And this was a before treatment, and this is an after treatment. It's mild improvement. I don't think it's a terrific or strong result, but about half the patients, or just under half the patients, were satisfied with the 1 treatment. But we certainly wouldn't sort of promote this as a once-off treatment. This is a close-up of really to show the slight PIH rather than the significant improvement in the stretch marks, which we didn't find. So, in summary, so I've only taken 4 minutes, that's good so far. In summary, the PIH was an issue, and it was hard to predict with the patient's Fitzpatrick skin type. There was a minor improvement, but this issue of PRP and how it's made, I had a couple of tubes of regen lying around, and I tried the regen, doing the same protocol as they recommend in their literature, and in both the samples found that there were no platelets that were found by the laboratory. So the regen produced no platelets. Now maybe they had been activated and the growth factors released, but there was certainly no platelets in it. And with the platelets, is there a concentration of platelets that we really need in order to reach a critical mass of growth factors to produce a result? Some people say that you need 1 million platelets per microliter in order to start getting that ideal result. And today, I mean, there's been a lot of information today. Some of the speakers have spoken about the molecular basis of how the laser works, and I think that that's really important to try and understand, particularly the role of heat shock proteins. And not many people have spoken about stem cells, but I'm sure that there's activation of stem cells through the laser mechanisms that we found today. That's it. You're all free.